Good evening. Thank you for having me. Happy to be here tonight to give you another update on where we are with COVID. I am going to share my screen here. Hopefully you can all see my screen. Yep, good. Okay. So where we are tonight, is too far here. Sorry. Here we go. So we had 24 new cases reported today. You can see by the graph that we are on a strong downswing from our peak in early January, late December from the Omicron. So overall downward trend. We still are seeing spikes occasionally, and I will say that Mondays tend to be a really low case count day because of the weekend. So we'll probably see a little bit of a bump up tomorrow. That's been the pattern so far. I know that many of you watch very carefully and hear on the news about the CDC. The CDC has recently changed its community levels, and I want to spend a few minutes talking about this and where these levels come from, because I think people may be worried a little bit because Albemarle and the city of Charlottesville show as a very high indicator. So you can see the map here. CDC has now lowered it down to 3 levels, low, medium, and high. You can see in Virginia right now, most of Northern Virginia and the Tidewater Eastern Shore area has actually moved into the low area, with most of the southwest tail in the high area. Here in Charlottesville, and when you look, it's called Charlottesville City County. We are listed in the high. So the recommendations are to wear a mask indoors, make sure you're up to date with your COVID vaccines. And remember that might include it does include a booster, and to get tested if you have symptoms. Let me explain how they come up with these numbers, because I think it's a little disheartening. We have such high vaccination levels for us to be at such a high, to be listed as a high community level. And so what I've done here is pull the data that went behind here. So there are 3 components that go into making the new CDC COVID-19 community levels. The first thing that they look at is the number of cases per 100,000. 100,000 is used. They normalize that value because all counties and communities across the nation have vastly different population levels. And so this is a way for them to be able to come up with one metric for all areas. And I've just pulled here all of the localities for the Blue Ridge Health District, and you can see Charlottesville City is down here at the bottom. Right now, there are 224 cases per 100,000 individuals. And this is a 7-day average that they look at. So this was last updated on last Thursday, March the 3rd. So once you have that data, and it is available on the CDC website, although I confess you have to dig a little bit to get it. You either put yourself in the fewer than 200 or the more than 200 per cases per 100,000. And the rationale behind this is that cases per 100,000 is a leading indicator. That is, if you have a high caseload, that's an indication that you might have a high burden to your hospitals. And that's what the other 2 metrics that go into this really look at, is burden on the hospital. And they're looking at 2 indicators. They're looking at the COVID inpatient bed utilization, and they're looking at COVID hospital admissions per 100,000 population. Now you'll notice it says here health services area, and they all say Albemarle. And that's because they're getting this information, the bed utilization and the hospital admissions per 100,000. And they're using that for the entire service area. They do not break that out for individual localities. The reason behind that is that a hospital is what is called a regional asset. That means, if you think about it, UVA admits individuals from all over the area, not just Charlottesville, and the same for Sentara Martha Jefferson. So all of our localities are in the same health services area, but there are also a lot of other localities that are part of the Albemarle area, health service area. So Culpeper is also considered part of that area, Madison, Rappahannock, Buckingham County, a whole slew go into that are not necessarily, certainly not in Charlottesville, and not necessarily part of the Blue Ridge Health District. Now, if you look down at the community levels, there are two different numbers depending on if you're in the 200 or more or fewer than 200. So here, if you have fewer than 200, this 6.8 actually puts you down here in the low, in the percent of inpatient beds and the percent hospitalized. And the 15.1 puts you in the median. And the CDC will assign whatever is the higher category. So for all of the other localities in our health district, except Albemarle and Charlottesville, where they have cases that are below 200 per 100,000, they would use this. And if you look at the map, they are all in the medium risk category. But because both Albemarle and Charlottesville are slightly higher than the 200 or more, that changes the numbers that we use or the cutoffs for medium and high. So now that 6.8% is in the median range. Here it was in the low, and the 15.1 puts Charlottesville and Albemarle up here in the high range. And again, the CDC is going to assign whatever is the highest risk value to the community based on that. So at this point in time, VDH is examining and trying to really understand the implications of this and how it might affect our community. It's certainly one more piece of data. It is certainly a very convenient way to help individuals decide what they should do on a day-to-day basis. But you can see just small numbers, particularly in communities that have small populations where each individual case of COVID counts for a lot more when you are rounding up or adjusting to per 100K, can have pretty dramatic changes. So should we proceed with that, I can foresee that at least for the next few weeks, both Charlottesville and Albemarle might bounce between medium and high. And that's a little confusing for individuals. And so, as I said, VDH is still examining this to try and parse out what it's going to mean for the community. So I wanted you all to understand, because when you look at that, it looks very distressing to see both Charlottesville and Albemarle in the high area. I do want to just take a look at the hospitalization numbers. This is Centera pulled this morning. They are reporting 5 individuals with COVID in their hospital beds right now. And you can see they've had a gradual trend since early January downward. And here we have UVAs, and they have also begun to show a gradual trend. Still a pretty high number of people hospitalized. 47 yesterday were reported with 3 admissions yesterday. And you can see that even though they've had this gradual trend, these lines here represent days when they've had really high admissions. So still pretty concerning, but definitely heading in the right direction with regards to our hospital utilization. I showed you this graph last time, showing you it again. We're pretty much all Omicron variant at this point in time. The Delta variant has really dramatically fallen off here and really been taken over by Omicron. We're not reporting here any of the subtle Omicron, the B2A, but we have had 1 or 2 cases in the region, but so far doesn't seem to be making a big impact on us. So again, vaccination is really the most important thing to do to keep yourself safe. We continue to have a very slow but steady increase in the number of individuals that are getting vaccinated. So you can see there's been about 300 additional people since the last time I talked who have started on their vaccination, gotten at least 1 dose. So that's great to see, and we're happy to provide that vaccine for free for anyone who wants it. Pretty good percentage of the population, and really an excellent percentage of the population for adults. who have at least one dose. And we're seeing increases in the number of people who are fully vaccinated. That is, they not only started to get that vaccine, but are getting their second and their booster shot. So 69% of the population is fully vaccinated. For adults, it's 73. That difference is, remember, this is first dose, and this is getting all of your doses. And we've had about 50% of adults that have gone ahead and gotten their booster dose. And I really am highly encouraging everyone, if you have not gotten your booster, to please do that. It's really important to have that additional shot to have full immunity. Just a reminder that vaccinations save lives. Where we see higher vaccination rates, we see lower death rates, and that's that decreasing line here. Here's the percentage of people who are vaccinated. Here's the deaths per 1,000, and you can see in our community and for the greater state, it really is a very sharp decline as vaccinations increase. So when you're out and about, keep yourself safe, get vaccinated, upgrade your mask. And I am strongly encouraging people to continue to wear a mask indoors. Even though we are on the bubble there of the CDC guidelines, we are still seeing a pretty significant number of cases in our community. Remember about distance and outdoors, and of course, wash your hands. So we are no longer calling every case of COVID, nor are we doing contact tracing. So I think it's important to remind people what to do if they come down, if they get self-tested, or if they go to their physician and get tested and they get diagnosed with COVID. So if you're infected, the important thing to do is isolate for at least 5 days. Continue that isolation longer if your symptoms are more than mild or if you have a continued fever. On days 6 through 10, individuals can leave isolation if they're improving, but they need to wear a mask because there's a chance that they may still be infectious. We've actually done some really interesting research even here locally that has shown that people do convert well beyond 5 days. It's a small percentage, but we do see people converting and becoming positive. So people are infectious after that 5 days. If you have an opportunity to do a self-test, an antigen test, that can be helpful. And if it's positive, of course, stay in isolation. If you find out that you're exposed, either through an online app or because someone tells you, then you need to quarantine. If you're fully vaccinated and you've had your booster, then the recommendations are that you just wear a well-fitting mask while you're around others for 10 days. If you've had COVID within the last 90 days, you have very strong immunity. And again, you don't need to quarantine if you're exposed again after you've recovered. But if you're not vaccinated or if you haven't had your booster, then you need to quarantine for 5 days, wear a well-fitting mask. And then finally, we really recommend that if you do know that you're exposed, to get tested 5 days after exposure or when symptoms develop. Testing locations, I'm not going to read through all of these. These are really the same as they've been, except that our community testing center at the Pantop Shopping Center will be closing on March 15th. That's really going to be the last day at that point in time. Remember, they're at Pantop Shopping Center. They're open from 9 to 5:30. There will still be other opportunities to get testing. We do have rapid tests that we can either provide at the health department, or they're available at pharmacies and grocery stores everywhere. So still lots of testing available, but the community testing location will be closing on March the 15th. And then in regards to vaccination, again, we're vaccinating at every health department in the afternoon, and you can see where we're at here. We still do Moby on the Mall. On Mondays, we were there today and actually had a lot of people stop by to get their booster or their first vaccine. So that's great to see. Our community vaccination center at Seminole Square will be closing on March the 12th. That is its last day. So if you have not gotten your booster, now is a really great time to go over there. They can do walk-ins. They're very fast, very efficient. Really encouraging people to use that resource while it's available, but they will be closing their doors on March the 12th. So if you've been putting it off, now's the day to do it. And I'll just leave with our hotline number and of course, vaccines.gov. There are other places besides Blue Ridge Health District to get your vaccines. They're available at pharmacies and physician offices everywhere. So I'll stop sharing and I am happy to answer any questions that you may have.
Councilors have any questions for Dr. Bonds? Well, I've got one. Dr. Bonds, you had sent an email to Ashley Marshall back on February 14th, which got copied to us through another circle just today, commenting on the kinds of factors that you recommend we consider when deciding whether to go back to in-person meetings. That's basically the last thing on our agenda. And to do you the favor of letting you opine early rather than asking you that you hang around and tell us what you think when the topic comes up, could I ask you to talk a little bit about the kinds of data metrics that you think perhaps we should be looking at in deciding when to go back into in-person meetings?
Yeah, so, that's a really great question. I think right now, all of the trends are very favorable. Our case count is still a little high, but it is trending downward. Our hospital capacity is strong at this point in time, and the number of people being admitted with COVID is low. I think things to consider are, will the meeting only be in person or will you do a hybrid form? Because it is still quite risky for some individuals who have immune compromise, who can't get vaccinated for whatever reason, or have been vaccinated and are just not mounting a strong immune response. It's really critical that those individuals still have the opportunity that they've had over the last 2 years with Zoom meetings to participate. So that would be one consideration. I think another consideration would be whether or not you would require masks during the meeting. City council chambers in the past has been quite crowded and a lot of people want to show up and voice their opinion about particular matters. We know that a well-fitting mask really reduces the risk. Certainly, if it were possible to hold council meetings in a larger or more open space, that would allow that distancing that we know helps reduce the risk of infection. So metrics that I might look at, I probably wouldn't use a daily case count for a couple of reasons. One, it tends to fluctuate a lot. I think instead I would look at weekly case counts over time, and I would want to see those trending down. I would want to see that our hospital capacity is very strong, that they have minimal number of COVID cases hospitalized, so that would an outbreak happen, that would not risk a strain on our hospital systems. I think those are the factors. I probably wouldn't look at percent positivity. There are so many people who are using rapid tests and home tests now that you really just don't know what that means anymore. So I don't think that that's a great metric to use at this point in time. I actually think the CDC metrics are very reasonable metrics. I'm just worried that the focus, the division of case count between 200 greater or less, when you're bouncing around that 200 mark, that can result in a lot of oscillations between medium and high or low and medium, which could be very confusing. But that's, I think, certainly as long as you understand those limitations and can look at the data behind those recommendations to see what's going on, I think that might be a very reasonable and easy metric to look at. You know, it's a challenge to make that determination. And I'm not sure that there's one specific thing. I think it's looking at the total of where we are and where we're moving with COVID.
And of course, one other advantage is that we get to hear from you once a month, and you can update us a month from now and tell us if things have changed for the positive.
I am always happy to come and talk about anything to City Council, but I'm happy to give you an update on that. And certainly, you know, at VDH, we're having lots of meetings about these new CBC metrics, and there are going to be some changes. If you've looked at the VDH website, there's a lot of headers that say that the data will be changing, that how it's presented and the type of data. And I'll certainly keep you apprised as those changes happen. I think you want to give lots of notice and advance warning as you go back to in person so that people can plan accordingly.
Okay, thank you. Anybody have other questions for Dr. Bonds? All right, thank you, Dr. Bonds.
Thank you.
Appreciate you stopping by, even
Happy to be here.
virtually.